So we're going to go through some low back stretches here like we did in our last appointment. As I mentioned, if there's anything that causes more pain or discomfort while you're at home doing these, make sure you stop and let me know. Or if there's any further questions, we can discuss that at your next appointment. Okay, so when you're at home here, I want you to try to get you on as hard of a surface as possible. So if you have a yoga mat or anything of that nature, you can set that down on the floor. If you're in an extraordinary amount of pain, you can do this on your bed as well, but I would like you on some type of flat surface if at all possible. So today I have a little stepper bench here. If you have a weightlifting bench, that could work. But as I mentioned, getting down on the floor would be your best bet. So I'm going to get down on the stepper bench here. When you go down here, you just want to make sure that no matter what surface you're on, your head is supported. If you do have some neck issues, you can put a light pillow underneath your neck, but I want to make sure that you're also not having a pillow that's driving your head up like this. So we want to try to keep your spine nice and straight as much as possible. So the first stretch we're going to go through, again, is for your low back. What I want you to do is lift up your knee. I want you to grab behind your knee and then gently pull towards your chest. You're going to hold this for about 10 to 15 seconds, and then nice and easy, you're going to drop that down, okay? Just like that. Now, the reason I have you doing this behind your knee, some of you might have been taught to grab on top of the knee. If there's any type of knee issue whatsoever, that can put a lot of extra stress and tension on that joint. By grabbing behind the knee, we alleviate that problem, but we also get a little bit better stretch and pull, especially if we're talking about things like sciatica pain or things of that nature. So again, just pulling back like this, about 10 to 15 seconds, drop it down nice and easy, and then we're going to switch to the other side. We're going to switch to the other leg, same thing, grabbing behind, pull nice and easy towards your chest, 10 to 15 seconds, and then drop it down. You're going to repeat that for about 2 to 3 sets for each leg, and then you're going to move on to doing both legs. So when you're ready to do the both legs, same thing, you're going to pull one leg up at a time, grab behind your knees, again, not on top, and you're just going to gently pull in towards your chest. If you feel comfortable enough, we're going to have you also rock slightly side to side. Notice I'm not really severely rocking all the way to the side, okay? Because that's going to put more stress and tension on the low back. Just a little rock side to side, 10 to 15 seconds, drop it down, and repeat for that 2 to 3 set period, okay? Throughout a day, there's no set number necessarily that you want to do this. In general, good rule of thumb, morning, afternoon, and night. But let's say you're at work and you can't, get away on the floor, you don't have any place to lie down. I'm going to now go through some different stretches here in a second that you can also do in the workplace or in a chair or something of that nature. One other stretch I want to show you here first, though, is you're on your back and you're going to be having your leg up in the air like this, crossing your leg over, okay? Grabbing behind that knee again and gently pulling back towards your chest. So if we've talked about things like piriformis syndrome or anything of that nature, this is stretching your piriformis. Now there's 2 fibers, as I mentioned, to your piriformis. This is the one most commonly known. The second one is similar to the first stretch I had you do. You're going to pull your leg toward your chest, but you're also going to come across. Here I am going to have you grab on top of your leg, giving yourself a nice big hug. You just want to make sure if you're looking at my knee, I'm not adding extra stress to that knee. I'm pulling right across to my opposite shoulder here, okay? Holding everything for about 10 to 15 seconds, and then dropping down, coming back up again.